Good morning. What an amazing video and amazing work by all of you to get us to 35,000 units. Thank you. And I would like to thank the mayor for his commitment of 15,000 units, the largest single commitment to date for supportive housing. We have 2 weeks until the end of session, and we need the governor and the legislators to sign the memorandum of understanding for the $1.9 billion in capital funding. All that is standing between us and the first 6,000 units is the MOU. At a time of record homelessness, please raise your voices. Let the governor and the legislators know how important this is to you. There are flyers on the registration table and on Enterprise and CSH's table that will tell you how to help. We are so close to getting this done. We need those 35,000 units, and we need your help to get us there. Okay, that's the end of my pitch. So welcome to our 16th annual Supportive Housing Conference. This is the largest conference on supportive housing in the country. We have over 1,500 registered attendees and providers from all across New York State and guests as far away as London. So we have a lot of interest in supportive housing. The network staff has organized for you 23 workshops. We plan this day entirely in-house, and I would like to thank the staff and also Sydney Kopp-Richardson in particular. This was her first planning of the conference. So thank you. Thank you, staff. I would like to also thank our volunteers and our panelists and our moderators. Without you, this day would not be happening. Thank you to our exhibitors and our sponsors. Please feel free to see all that's available to you outside. And a special thanks to my board, who is amazing and helps at any time. They refuse no request. Thank you so much. And to our city and state government partners, we could not do this work without you. Thank you so much for your dedication. And last but not least, our providers. We would not be here today without your brilliance and dedication. So we are at a crossroads. We have built 50,000 units of supportive housing, and we are ready for the next 35,000. Let's take a moment to reflect on where we have come from. 30 years ago, before there was supportive housing, there were very few choices for individuals who were mentally ill or living with a disability. If you didn't have the strong family ties or resources, you were often left in an institution where you were likely to have a poor quality of life. And when we began to lose substandard housing in the community that these people relied on as well, it got even worse, and more and more people experienced homelessness. There were just a few people at that time who understood it wasn't enough just to offer services in a clinic. They knew that you had to do more than just fix up buildings. And while these early supportive housing pioneers certainly moved forward with a great sense of urgency, they didn't come at it with preconceived notions. They didn't tell their tenants what they needed. They asked them what they wanted. And sure enough, by listening, these pioneers were able to meet people's needs in a comprehensive way. They didn't just keep people from becoming homeless, they gave people homes. Supportive housing was mostly in Manhattan due to all of our SRO preservation efforts, and now it is in every single county across the state of New York and all across the country. It's amazing. And now we have this big conference with over 1,500 attendees to discuss what's happening in our industry. We have learned to use sophisticated financing models that ensure that the buildings will remain affordable at all times and for the future. We share political strategies for convincing taxpayers and the government why they need to invest in supportive housing. We're here today because we've been very successful at solving a problem that has resisted solutions. But as we continue our quest for the knowledge and will make us ever more effective, I hope that we can remember our beginning. We need to remember it's not just about the numbers placed, units built, dollars saved. It's about creating homes, healthy, safe residences for people and families to live, places that interact and give back to their communities. In many ways, supportive housing seems like a miracle. We place a person who has been ill-served by public systems, and they become model tenants and good neighbors in supportive housing. But it's not a miracle. It's the end result of years of hard work and experimentation, sharing of best practices, and fighting for more resources to do what we do. Today, we are a most diverse group than ever before. We serve singles and families, individuals with mental health issues, substance abuse issues, youth aging out of foster care, those individuals leaving from incarceration. We serve many, many diverse populations. We need to make sure that the housing and service model we offer is as effective as possible. One size does not fit all. At a time of record homelessness, we need to build more than we ever have. We need to push ourselves. Supportive housing providers are the most sophisticated developers in New York State. With all the capital and service and operating funds we need to be. But we have to take a chance and expand our capacity. Large groups need to get larger, small groups need to get larger, and we need to find partners and any opportunity to help us get the job done. And this conference is designed to help us think that through. So this morning, we have the opportunity to hear from Deputy Mayor Herminia Palacio for Health and Human Services. We are going to hear from Commissioner Rubin from HCR. We're going to build on our theme of storytelling that we started at the last conference. We have the opportunity to hear from Tony Hannigan, who's the CEO of CUCS, Center for Urban Community Services. And most importantly, we're hearing from two of our amazing tenants about their story. For the first time, we will offer coffee before the last workshop, so that's exciting. You don't need to run to Starbucks, which is great. You'll be on time for that third panel. And we also are moving to the 8th floor for the cocktail party because we were bursting at the seams last year, so we're excited to be there. So thank you very much for coming and for your support. Mm-hmm. Thank you. So it's my pleasure to introduce Deputy Mayor Herminia Palacio. She was appointed Deputy Mayor in January 2016, so not too long ago, and she has been on roller skates ever since, hitting and diving into many, many issues that affect our community. Two of those major initiatives is the implementation of the DHS 90-day review and the One New York, Healthcare for Our Neighborhoods, a comprehensive program to deal with our Health and Hospitals Corporation, who is the largest provider of health services to our community. So it is my pleasure to introduce Deputy Mayor Herminia Palacio.